I just would like to just mention quickly that you'll see there's a lot of people in the audience, and I just wanted to acknowledge that there are a lot of executive directors from Union County and community-based organizations that are here this evening, along with, for the first time in my 23 years of doing budget hearings, all of my division heads. Yeah, I'd just like to say Sid Blanchard from Community Access, Camden Pagey from Prevention Links, Richard Havlicek from FACT, Richard Rogers from the Union County Psychiatric Clinic, Ella Teal from Urban League, Chad William from the YWCA, and Frank Brady and James Chafe from Center for Hope Hospice. They're all in the audience. They're here because they know that in the past and continued for many, many years in the future, boards have been very supportive of the needs of the community. And these are the people, obviously, that are there every single day and deal with clients. So they're here as support for that, and I thank them all for coming tonight. So with that said, Mr. Chairman. Well, let me just say that I mentioned a minute ago, 22 years, this is by far, I believe, that I've been doing these, it's probably the largest budget request that I've had relative to positions. It illustrates the need that exists out in the community as a result of that. I saw the format that Director Graziano went through, and if that's the format you'd like to follow, I'd be happy to do so. But I thought, if I may, there are certain budget drivers within this presentation, I think, that maybe we should just get right to. And anything else that comes as a result of that, obviously, will be able to answer questions. So it's up to you. I'll follow whatever format that the board desires, but I'd like to call your attention to those issues I believe that probably are going to stick out and already have done so. Let's start with welfare, because I think that probably is the largest budget driver that you're going to see within this presentation this evening. And as you see from your packages, the department has, you see right there, the department is requesting 24 new positions this year in the budget for the Division of Social Services. That's a large increase, understandably. All I will say at this point is, if you can recall, and will recall, there have been many newspaper stories over the last year with lions snaking outdoors, and I think they even used our social services building as an example. That is statewide. It's not unique to Union County. The fact of the matter is that programs have exploded, and unfortunately staffing across the state of New Jersey relative to the CWAs has not exploded with it. And as a result of that, the direct impact is on clients and our ability to serve them and what we believe and what the state believes in a timely manner. As you can see from the slide, we've broken out that the salary costs for those positions. As you know, we use a roughly 50% offset relative to federal and state reimbursement. I think that is conservative, but 50% for this conversation is probably adequate. And there is an OE increase relative to the overall budget, but that comes in the area of more fixed costs, i.e. rent increases that are under in lease agreements. And so most of that is coming into those areas, plus we've added another site that also adds to more expenses on the OE side of this.
So just always one, so how many total positions? 24 additional full-time positions.
Yes.
Any questions on that? Thank you, Brett.
The other area, I think that if we can come back, of course, at any time if questions come up. The other area that is a large increase, but also has some offsets that we've not had before, is the juvenile detention center. There are positions, just give me 1 second, I'm trying to get out of Cornerstone and get into the department at this point. folder, I apologize. In juvenile, you see that there are increases in requests for new positions. Those positions, if you would recall, in many sessions dealing with things like transition from Hudson County and whatnot, we looked at what we would need and what we wouldn't need. These positions are not on line staff, these are in the supervisory area. One of the things with the new superintendent, since she's been there, has noticed, and I agree with and support, is that there is a lack of supervision at the top levels. Unlike most facilities, there is a chain of command that exists. The chain of command that has been in that facility has been poor, to say the least, and it has not served us well. And as a result of that, there have been issues that have come up. Many of you are familiar with them. So this is a request by her, which I do support, to add some supervisory positions to assist with the day-to-day operation and chain of command within a juvenile correctional facility. Secondly, we can get into, and I'd like to touch briefly on the contract and where we are relative to goals and objectives and what we anticipate for this year. One of the things I believe in the initiatives for next year is to safely transition all Hudson County kids into the facility by the end of the first quarter. I cheated a little bit. We started this week, and we anticipate being done, I believe, by Friday of this week.
Correct.
So all of the Hudson County kids will be in the facility, and I guess Hudson will effectively close by the end of this week. The revenue that's going to be generated by that is a very conservative estimate. What we did was I looked at, and you have before you the guarantee, which is a guaranteed 20 beds, or we guarantee 20 beds would be available for their use at $230 per diem. The average daily population in Hudson, though, is more in the area of 29 to 30, a little bit higher on occasion. So we will far exceed those 20-bed guarantees. We anticipate at least 10 or 11 kids more on a daily basis coming in now that we've started, albeit we've started about a month and a half late. And the reason for that was a constant back and forth with Hudson County and the Juvenile Justice Commission in order to get the plan approved. It was just approved on Monday, I believe it was. So we are now moving ahead. The same thing for the federal program that's still in place, which is the DUCS program. We only put revenue in for the first 6 months of the year. The reason we did that is because we were trying to figure out what the population will look like in the house and not have overcrowding. But at this point, it is still in there, and we've not served notice to the federal government that we're going to eliminate or quit. We actually have 60 days within that agreement. We have a 60-day notice, and we may exercise it depending on how that population looks. But so we anticipate, again, at least realizing the $550,000 in revenue, which is roughly half that we receive on a yearly basis, because that, again, is a 10-bed guarantee. Whether they use the beds or not, they pay us for 10 beds a day. And then lastly, there is the reimbursement from the SFEA, which is the school funding. We realized about $130,000 last year in that. That, of course, will jump for the next year, rather. That famous October 15th magic count that occurs in all schools also is included in correctional facilities or detention facilities. And by the time that takes place in October, we anticipate having at least double the population that we've had over the life of the new facility. So, of course, that revenue, again, will increase. The payout and the offset would be in the areas of housing juveniles if we become overcrowded, and our recent decision to not house any females any longer in the facility while we hold this contract. I can stop. Any questions?
Further Shaw?
Good question. Have your offsets, you have $550,000 by the federal DUTS contract. Now, that's a weighted number. It includes many other services that we provide besides just the housing of the individuals, right?
It does, it includes supervision, housing, and programs, yes, if that was the question. In other words, it's a very intensive program. They require special types of program above and beyond what the state requires for the kids that are under our care. But all of that is part of the per diem cost.
So the 550 is for 10 individuals. But the contract also.
Well, it's an annualized basis, and it's 1 million. I can't do the math, but it's double that. It's actually double that on an annualized basis. And it's 10 beds. They pay for 10 beds whether they use them or not. Up until recently, when we've seen the population increase a little bit more than they have in the past, we've averaged around 1 child a day, 1 to 2. So regardless of that, they still pay us for 10 beds every day.
The reason for my questioning is because I wanted to see comparison, trying to compare apples with apples, how the DUTS fares with Hudson County. And here's Hudson County got a good deal that year.
Well, Hudson County got a good deal, but they got a higher deal than most other detention centers are getting statewide because, if you recall, we discussed the per diem rate, I think, in a session publicly. And if you actually, based on all detention centers in the state, that roughly operate at about half of their capacity these days, which is the reason why you're seeing all of these consolidation. If you take the way that normally you do a per diem rate, the per diem rate, we would have to charge Hudson County roughly about $650 to $700 a day per child. It's just
Right,
not.
we take everything and add it in.
It's just not, and that's the way that some people would tell you to do it, but it's not the way to do it. The statewide average for housing ranges between 215 and I think around 260, somewhere around that. So we're in that range, 230 right now. Next year you'll see an increase of another $10 per diem. So we're about in the middle, maybe the high middle statewide for everybody that's gone through these consolidations in the past. And as you would recall, we're sending girls to Bergen County for $225 a day. And anybody else that we may need to do that as a result of perhaps being overcrowded in the future.
Plus we pay for transportation as well. For anybody that was sending out of Bergen County. If you send it to Bergen County, you pay for you and I, and you pay for the transportation.
Well, right now, yes. Right now, and the way that we've worked it out at this point, again, let me just, at this time, at this date, the only thing that we're talking about is roughly, let me give you the example. Last year, and the reason why we made the decision to house girls in Bergen is we had 21 total admissions the entire year in the facility. If we didn't do that, you well know we have an 8-bed unit, 7 beds would have been lost to us. The Union County Police Department has agreed to pick that female up wherever they are arrested, which helps the municipalities because now the municipality does not have to take a car, take them out of sector, and bring them to the detention center to drop the child off. The county police will do that, drive them to Bergen County. If in fact, when there are court appearances, the sheriff's department will provide the transportation, as the sheriff does for all court appearances, whether they be adults or juveniles. So it is no different than what is happening right now with the sheriff.
Thank you.
Bill DeCarter.
In reference to the increase in staffing and under the salaries, and I understood the fact that you need to make that commitment to have, supervision there. But having the numbers that you're requesting, what is it based off of? Is it based off of the model? Is it based off of what state requirements are? Or is it something we kind of are just projecting based off of the number?
Well, the expert's sitting in the audience, but I'm going to take a stab at it, as you probably thought I would anyway.
I know.
The fact of the matter is it's really based on the number of supervisors and the number of line officers that we have. Right now, the supervision is not there to go up the chain of command and hold people accountable down the line. There is ratios that exist, obviously, and if I can ask, if you don't mind Diana answering it, she'd be happy to do so. That's up to you.
That's fine.
Yes.
Yeah, maybe she might want to make her way towards the stage.
Which is exactly what you do.
Robert, is it possible to grab a microphone for her? Oh, Jimmy's out. Sorry.
I think I've introduced her to everyone, so.
I have to say that Union County is the only detention center that has one supervisor assigned to each shift. Everybody else has a chain of command that includes at least a director of custody, a chief, and several supervisors on each shift, depending on the operations. Obviously, 11 to 7, there's less activity, almost no activity. So you could go down to 1 or 2 people, but you still need a relief factor. Currently at the Union County Detention Center, we are running with 2 supervisors for all 3 shifts. We had a chief who retired probably 2 months ago, another supervisor who retired the first of, I think this month, actually, March. And we are now running with 2 supervisors. And Ms. Perez, my assistant, and myself are actually doing the duties of the supervisor. And it's really not the way for us to be running. We need to do our duties. And we are severely short-staffed in administration and the line staff supervision. We have almost 70 officers with 2 supervisors. Currently.
But if I can just expand on that just a hair. This illustrates one of the issues that confronts not only the county, Union County, in terms of its setup, but also statewide. And that's the issue of having civil service be involved relative to these types of positions. What happens is they promulgate lists, you go through those lists, and I will tell you as an example, we had 3 people go today for psychological, all 3 failed. They know when we get down to the bottom of any list in terms of what you're going to be refined for, people that you would want to work with kids. I firmly believe, I truly believe, that there are some positions that should not be left to just a test, particularly those that have to do with children, kids, and whether they're children in a daycare, whether they're children in a detention center or in a shelter home. And, we really have to look closely at what our ability can be in the future in order to rapidly replace people as they left, because as you well know, when you can't replace positions, it drives overtime. And just because someone is a good test taker, it doesn't necessarily mean that they're going to be able to do that job that you need to do on a daily basis. So this is one of those areas where, I think that we need to get more involved, because it's not just us. It is a statewide issue relative to how you select people to work in these types of facilities. And there has to be, and there should be another way to do that than the way that we use today.
Go ahead. Question, when we look at the number of supervisors that are being proposed, that means 5 new supervisors?
That wasn't my original.
She wanted more. But we're going to start where I thought we could, and then we'll go from there in future years.
Right, so we've not maintained any of the previous supervisors, that we have a new set.
These are, if I may, these are new positions, Freeholder. What I believe that Diana had mentioned is we've had a lot of people leave for various reasons. And not only are we in the process of trying to fill those vacancies, but, as you know, we're in the process of bringing other kids in, so we want to be able to get the full staff as quickly as we can. But these are existing vacancies, plus if the board approves, obviously down the line in the budget process, there will be additional positions that we want to fill.
Okay, so our total of how many that we need to be filled,
New positions, Freeholder?
plus the vacant ones.
The vacancies at this point, I'd have to go into detail.
Off the top of my head, the chief's position is vacant right now. We currently have 2 vacant supervisor positions through retirements.
And line officers that you have.
Line officers, I believe we're hiring 14. We just hired 3, so we're down to 11, I believe.
Field, there's any other questions regarding the juvenile detention center? Thank you very much. Do we want to run through just the other, I know we spent some time on social services departments. Do any other departments you want to highlight? Do you want to run through quickly the other line items?
We can just just go through it very quickly. Of course, we'll not go through those 2 departments again.
Certainly.
Okay. We can start with the Office of Director. There is an increase in salaries. It was mentioned earlier, I know someone of you mentioned the impact of pure roofing. I think when Joe Graz was up here, obviously it's also affected very much so the department. Not so much, and not only in staffing, but also services that go out into the community. The ARP, which is the Alcohol Recovery Program, those dollars were match dollars that we received directly as a result of having Runnels Hospital. The state allowed us to use Runnels as the match for that particular grant, which is approximately $911,000. So they allowed us to use that match. Now that needs to be cash match as opposed to using Runnels as before.
Have we looked at any other, or looked at obtaining, it's always nice to say we want to obtain a grant, but have we used, one of our various grant writing services, maybe, just find another avenue of funding to match?
We've looked with them and worked with them in the past, and other consultants. We're working them to death right now on some other grant stuff that we
As we should.
As we should. I know that well. But the answer is yes. We're constantly, looking for sources to offset county dollars. The fact of the matter is, and you heard it from the previous presentation by Joe, you're seeing a continuous, constant loss in state and federal funding, and it gets pushed down to the local level, and you're asked to make up the difference. And that basically is what's happening across the board, no matter what grants you're handling these days.
If I may, Madam Chairman, if I may, just to kind of sum it up, since 2008, the poverty level has increased approximately 16%. Ironically, grant funding has decreased by about 16% over that same period. So that kind of sums it up.
That's astonishing. Thank you.
So just finishing this off, the couple of things that we're doing, obviously, we're working with the Chairman's Initiative this year for the child care. We also are right in the midst of dealing with the Family Justice Center and the Domestic Violence Center that with the prosecutor's office and the assignment judge. So those are some initiative things that overall we'll be working on as we get through this year. Do you want to stop at accomplishments or something, or just keep going?
Schroeder's,
What's your pleasure?
Do you want to maybe we can, if you maybe you can kind of give us a highlight view of the accomplishments, if there's something you want to draw out, otherwise we have the information here. We can get more to the 15 goals.
I'm going to turn it over to Karen.
So, under the Office for the Director, under accomplishments this year, we continue to serve individuals with HIV and AIDS, so we've provided more than 1,200 residents with various emergency and support services for people that have HIV and AIDS. One of the interesting things that I thought the board would be interested in among our many accomplishments, the Office of the Veterans Affairs. As you know, we dedicated a medal a monument to the Medal of Honor recipients. We have also developed a curriculum for application in the public school system through all students of history, honoring those veterans, particularly those who received the Medal of Honor. And that curriculum has been applied starting in 2014. We also, as you see, placed 30,000 American flags on the graves of veterans throughout the Union County cemeteries. The Juvenile Detention Alternatives Initiative, you will see that in both accomplishments and initiatives. We received $120,000 in grant funding to seek and apply alternatives to juvenile detention, thereby keeping ourselves within the population control of the center. We've also received recognition from the National Annie Casey Foundation. So those are accomplishments, and then if you flip to initiatives, JDAI is going to further engage and educate parents in the overall juvenile justice system and work on some manuals and guides that will assist parents and guardians. Also, we are going to be applying training for municipal police departments and other community stakeholders on juvenile detention alternatives. Frank mentioned the expansion of child care. What is unique about the Freeholder Chairman's Initiative is that there are families that cannot be assisted through child care subsidy, sometimes because their income is $1 over the limit, or sometimes because the subsidy programs require that a parent be working, and you can't achieve child care while you're seeking work. So this initiative applies $50,000 to assist families that otherwise wouldn't be served with the child care subsidy. I'm sure it will be received among many families, but also will be applauded for having done so, because this has been a problem in the community for many years. And Frank mentioned we're working as a lead partner on the Domestic Violence Center initiative. We do have Jan Lillian in the audience today, who represents the agency that serves this target population. She will also be a partner. So this is an interesting new initiative that we're moving forward in 2015.
Just flip to the Division on Aging, because we'll stop with the detention. Just focusing on the OE increase again, and one of the things that we're asking for is around $63,000 to cover loss in meals. As you know, previous times and for many years, the board has been adamant about the fact that no one should be waiting for meals. This helps make sure that that does not happen. The other money that you see, the $254,000, is annual. That's the peer grouping loss. Those are services that would not be provided. The levels of service would go down as a result of not having these dollars available. You see them listed on that slide. Those are the types of services that people receive in the community as a result of that money being available for those types of services. Karen.
In 2014, the Division on Aging, and we also are an ADRC, so we serve both the aging and the disabled population. In 2014, the ADRC implemented a new screening tool called a Screen for Community Services. This expedites the process for determining eligibility for services for both seniors and people with disabilities, particularly to access Medicaid benefits and to receive the services that would be funded through Medicaid. In addition, more than 1,700 units of mental health screening, assessment, and treatment were provided to frail, isolated seniors and their caregivers. And we also implemented an exciting initiative called Care Transitions. This is a transition from hospitalization for individuals, particularly frail elderly, that may be at risk of multiple hospitalizations. We are a partner in this initiative, and we are coaching patients within the hospitals. We go into the hospitals, social workers do, and work with the patients and their caregivers to help them from returning to the hospital once they are discharged. This was implemented in September of 2014 and will be continued in 2015. And initiatives for 2015 for the Division on Aging, again, the screening will continue to try to expand the screening for benefits. Nutrition, we've talked about a need for additional dollars to preserve the number of meals. Currently, we have no waiting list for Meals on Wheels services. This is particularly important for at-risk seniors, so we continue to focus on nutrition and care transition program, which I just mentioned. We will continue to implement that program.
Youth services, which would be next. There's no increase in OE. There is a salary there for one position. Field and Marabella every year was asking me when would we move, and just the first year I can actually say we moved, but he's not here. And as a result of moving, we have a larger area to handle. We need another receptionist there. And I think the staff is happy about the fact that they're finally on the same room together in the building they were since I started, actually, way back in the Stone Age. The accomplishments.
On page 12, the accomplishments, I won't read through all of these. It shows numbers, levels of service that we achieved in family crisis intervention, community service activities, and youth service commission, largely through outside contract provided services. We still operate the Union County Juvenile Expediting Team, which reviewed 207 cases, providing case management and other monitoring services. Some of the agencies that are in the audience today sit on that UJEC committee. And this is a way to try to move the juveniles that are in the detention center and in the youth shelter through that process. Additionally, electronic client information and ETO system, we move forward with that with regard to improving the system, training the staff on how to implement. We've also expanded services in the division with regard to project management. And we were able to work with the Rutgers School of Social Work to provide student internship opportunities in the Division of Youth Services under Darrell Hatch.
Employment and training. There's no OE, so we don't have to discuss that. There is a request for a new position. It's a receptionist again. We actually need more receptionists. We had more in there, but we had to cut them back. You're familiar with the one-stop services. It provides services that basically policy is set by the Workforce Investment Board, and the one-stop is the entity that implements those policies locally to provide individuals that need to be trained and back in the workforce for various levels. Accomplishments, they helped us, and I'll hit this one quickly. They were a very, very, very avid and good partner with us. When Rose was closing, they helped provide some job fairs for people that were going to be affected by the layoff, that action that took place. And as I said, they continue to work in concert with the WIB to implement policies that help to, hopefully when companies come into the county and they need trained people to operate and to work, that we're training them in Union County and Union County residents for those jobs that are being created at the municipal level.
In 2015, the initiatives for the one-stop career centers, one of the changes that impact both our area as well as other counties is the provision of services for out-of-school youth. Previously, we provided a good deal of services for in-school youth. The out-of-school youth are a priority target population now, so we will establish a youth resource center to serve this population. Included in that center will be a safe space for individuals to access the computer safely on appropriate websites, and also to be looking for job and educational opportunities. And one of the initiatives we're looking at for 2015 is to expand to non-traditional hours, both our one-stop centers to open to serve the public.
Almost done. Planning. You don't want to go through social services again, I'm sure.
Is there a cost associated with that expansion now?
The cost would come in the area of, heating, whatever the case may be. We're going to try to work out, obviously, we've done this in the past with both social services and the one-stop. you know, we try to work it out where we schedule people accordingly on that day, so instead of coming in, they would come in later to work later. So we'll work it through. At this time, we don't anticipate a large cost, but obviously, you know, one of the biggest problems that we all have is that we operate traditional hours and people work, and they really need to access services. So the only way for people to access what we have and what we can provide to them is to operate on non-traditional hours. So we're gonna make an attempt to get through this and see how it works again.
No, I mean, I love the concept of the non-traditional hours. It makes sense. The only concern I ever had is, you know, perhaps you diminish the overall product. And I mean, if you're confident that that's not the case, then that's a great thing. And, you know, looking forward to seeing how this works.
It worked in the past, Mr. Chairman. You know, times have changed, obviously, but I believe based on the numbers we're just seeing at the doors in general, we'll get a traffic flow. We'll get foot traffic there.
Okay, good. Thank you.
Planning. There is an increase, salary increase of approximately $51,000, and this includes that as part of the partial funding of the loss of the alcohol recovery program I mentioned earlier. In addition to that, the OE has about a $215,000 increase due to, again, the loss of Peter Rubin. These are services that are provided into the community through RFP processes, and they fund gaps that grants and other services just don't allow to be funded. No, we're not going to go through all the accomplishments, thankfully. I'll just say that we'll stop at the paratransit, which is the last, and the reason why I want to do that is because for many years we've been talking about advertising on the buses, and if anyone has seen them recently, you may have seen some advertising on them, and if not, I encourage you to just, well, you should have your eyes up when you're driving anyway, but I think 11 vehicles at this point have advertising on it by 15, by 2 companies.
Yes, Nationwide and Atlantic Home Care.
It provides a small amount of revenue, and we'll continue to work with them and expand it. Hopefully, the market will bring more revenue. But it's an attempt to do that. As you well know, most of that funding is from casino revenue, and that has decreased steadily each and every year. Mr. Chairman, members of the board, that basically concludes what the department has to say. If there are any questions, be happy to answer them.
Realtors, any additional questions with the Department of Human Services? Thank you very much. We'll let you know.
Thank you.
Yes.
I'd just like to thank all of the representatives of the social service organizations who work with us. I know you are dealing with budget issues yourself,